Since having my 2 excision surgeries 4 years and 5 years ago, I would say I'm between 80 to 85% better, which is a massive improvement from how things used to be. I still have lung symptoms, as I mentioned, like shortness of breath, wheezing cough, and chest pain leading up to my period. And I do get the abdominal and pelvic pain, sometimes back and thigh pain as well, leading up to my cycles. So usually 3 to 5 days before my period and then the first 2 days of my period. Even though no endo was found on my scans, I still experience chronic fatigue. It's not nearly as bad as before, but it is debilitating at times, especially around my cycles. And I do experience heavy bleeding, very, very heavy bleeding. That is something that I'm working with my doctors on, trying to supplement my iron properly because regular iron supplements weren't working for me. So we've got another one I'll be trying, as well as a bleeding medication to see if that will help. I noticed the bleeding actually got worse after surgery, but I'll take the bleeding over the extreme pain and the screaming that I used to experience. And I do have one really painful day, which is usually the 4th day of my cycle, but my doctor said that taking the bleeding medication will help with that because it's just related to the buildup of everything going on during the period. But still, it's a lot more manageable than before, and there are of course other symptoms that pop up throughout the month, but overall I'm back to doing regular activities, things like cooking, cleaning, and driving.